Welcome, Dr. Valdez.
Well, thank you, Melissa. I look forward to our chat.
Do you mind if I call you Robert?
Well, why don't you call me what my friends in the health policy world call me? They call me Bob.
Bob. Okay, Bob. Let's start at ground zero. First, congratulations on your appointment, and thank you for leading the federal agency responsible for translating medical progress into healthcare progress, an essential facet of our nation's research and development ecosystem. I'd like to first ask, what led you to the Agency for Healthcare Research and Quality?
Well, thankfully, President Biden invited me to lead this organization. And it's really an opportunity of a lifetime to guide the only agency with the congressional authorities in the department that are devoted to improving healthcare in America. Healthcare improvement in all kinds of dimensions: quality, safety, affordability, you name it. The agency is responsible for pursuing that using the science base. And the pandemic has really strained our healthcare delivery system, creating opportunities to repair and to rebuild it for the better. And so, as they say, no good crisis should be lost. Take the opportunity to rebuild and rebuild better. As a non-regulatory science-based organization, we must rely on partnerships with medical societies, clinical societies of all types, healthcare delivery systems at the local level, payers. That partnership is critical to our ability to really fill that, identify knowledge that can be turned into action. And so we take an evidence-based approach that takes many, many different studies and tries to figure out what is the kernel of knowledge that we really have there, and how do we convert that knowledge into clinical practices that can be found around the country that improve the well-being and the health of our people. ARC creates tools and playbooks and creates data for monitoring purposes so that we know what we're doing, whether we're making any progress or not. So how could you not say yes to the president to come take on a job like that?
Well, if you put it that way, I can really understand. Health services research doesn't get the attention and the recognition that it deserves. So putting HSR to the kitchen table test, how do you convey the role and significance of health services research to those unfamiliar with it?
Well, lots of people, when you say science, they immediately jump to the ideas of biomedical science, that discovery piece, the front end of science. And then you just heard my dear colleague, Rob, talk about what FDA does as one of our sister agencies in science. It takes those discoveries that have been turned into products and makes sure that they're safe for the American public. At ARC, we take that next step. How do we take those kinds of pieces of evidence, those tools, that knowledge that's been published in thousands of different journals, and convert that to something that actually is effective in healthcare settings? So the goals of health services research are to identify the most effective ways to organize, manage, finance, and deliver high quality care. We're also trying to eliminate medical hazards that cause harm when people seek care. And we're also trying to improve the patient safety experience in every environment in which patients seek or receive their care. So health services research is kind of that far end of the science spectrum that's looking at application and practice.
That makes a lot of sense. Thinking about application and practice, and given your long history of contributions in health services research, the theme of this forum is then, now, imagine. And so in that framework, in that context, how would you characterize the quality of healthcare today relative to, let's say, 20 years ago?
Well, as you know, our healthcare system's been falling short of late. And in large part, the COVID-19 pandemic has really underscored the urgency of our work by revealing the inequities of our society that's reflected in how our healthcare is organized, financed, and produced. And we know from the annual ARC Quality and Disparities Report that we continue to make improvements in quality, but they're just not consistent in all areas, and certainly not for all populations. What's troubling is that throughout the course of this pandemic, we've lost ground, particularly lost ground in patient safety in many medical settings and many care settings. And we have an opportunity really to make those changes I talked about earlier. We know what needs to be done. We just need a recommitment by our healthcare systems, our payers, and others to regain what we've lost. But more importantly, given this theme, we often think about then and now. I've been trying to push us to think about the future.
Okay.
What is it that we can imagine? What do we want our healthcare system to look like in the 25th century? Not just the 22nd century, we're already in the 21st century. We want to provide 21st century care, which is of the highest quality. But we've got, if we're going to get that 24th century care, we've got to start thinking and imagining it now. And so how is it that we want healthcare to be delivered? How should it be delivered? What kinds of issues should we be thinking about now in order to create that high quality care for the future? So ARC is steadfast in its commitment to bring about improvements in the patient safety situation that we're facing now. But we're looking to the future, to how we make patient safety a non-issue in the future. And the only way we can do that is really to recognize the hazards that exist within care settings and begin to ameliorate them in advance, preventively. As I said to you in an earlier chat, I've always thought of prevention as primary. And so we've got to think about that. How do we build that into our healthcare system in such a way that we are ultimately providing high quality healthcare at every turn?
Prevention is primary. Prevention is primary. It's such a critical message. And for all of us in public health, it really resonates powerfully. And it's a matter of being able to ensure that all Americans are aware of how important prevention is. As you think, you talked about the future, as you think about the next 2 to 3 years, I know this will be a challenge to identify a top priority, one top priority for ARC.
Well, I actually have one top priority that wraps everything else up. And that is when people say ARC, I want them to think ARC is to healthcare systems as CDC is to public health systems. Okay. That is, we're an integral partner with local healthcare systems, helping them meet the challenges before they become crises, and helping them to provide safe, high quality, equitable, and affordable healthcare. That's the goal I'm looking for. That's where I'm trying to move us. And certainly, it'll be no small feat if we can gain an inch.
Thinking about the future, we have many students here at the College of Health and Human Services at George Mason across the country. We have many students thinking about careers in health services research, pursuing their studies. What types of advice would you like to give students that maybe might be considering going into health services research?
Well, the first thing I would recommend is that they learn a little bit about the founders of health services research, people like Kerr White, Avedis Danabedian, and others who really defined what health services research was and is. And that is a science-based examination that always asks, how can we deliver healthcare better? And what is the underlying processes and reasons that healthcare produces the outcome that it does, or doesn't produce the outcome it does? And we have lots of opportunities at ARC to help predoctoral and postdoctoral education and training and careers. So people who are interested in that should certainly look to our dissertation awards, look to our National Health Service Awards for individual predoctoral and postdoctoral fellowships. We have resources to help people gain those kinds of interdisciplinary training and skills that are necessary to learn the epidemiology, the health, the economics, the management, all the other sciences, behavioral and social, as well as the clinical understanding about how healthcare is being delivered or should be delivered. So it's an exciting field. I can certainly say that every day I still learn something new as a health services researcher, and ARC is the home to health services researchers. In fact, Per White, one of the founders of health services research, created in the 1960s the first agency within the Department of, it used to be Health and Education and Welfare, but the precursor for our current Department of Health and Human Services. But he also created the precursor to what we now call ARC. And so health services research has had a long opportunity to develop both in the academic world, but more importantly in public service and embedded in health services themselves and healthcare delivery systems themselves. And part of what we're doing here at ARC is we're also helping health services researchers become embedded in health services systems so that local health systems, in fact, raise the questions that need to be answered and they get the answers they need to improve.
That makes a lot of sense, and that historical perspective is so valuable. And as we've been talking about, there are a number of impacts on health services research and the healthcare quality environment, pressures that we never anticipated. So, for example, antimicrobial resistance, a very important issue as it relates to the delivery of quality medical care and overall healthcare quality. So what is some of the work that ARC is doing in terms of tools and capacities for addressing antimicrobial resistance?
Well, ARC's working very closely with our other federal partners in a task force that's called the Task Force for Combating Antibiotic Resistant Bacteria, or CARB. So low carb is what we're aiming for. With a goal of reducing antibiotic resistance by really carrying out the actions that are described in a National Action Plan for CARB. ARC supports the National Action Plan in three distinct ways. We fund research on infection prevention, again, prevention. We look at combating antibiotic resistance. We're also trying to find ways or new ways to improve the use of antibiotics. We also support the translation of significant findings from the larger research environment into practical resources that can help practitioners improve how the care they deliver is pursued. And we also invest in research that looks at how best to integrate FDA-approved new and existing diagnostics into the clinical care that our patients receive, trying to identify antibiotic-resistant infections and to inform the appropriate treatments of those cases. Our work on reducing antibiotic resistance is really part of an overall effort to reduce healthcare-associated infections that really focuses on improving antibiotic use and reducing the transmission of resistant organisms. You know, one of the things that we've done at ARC is we've illustrated how you can change antibiotic prescribing approaches in ambulatory settings. In a set of demonstration projects that we've done, we've shown that in clinics that pursued our safety program, we reduced by half the number of antibiotic related infections. So we know we can do it. We just need to get ourselves in there and aggressively take advantage of what we know and implement it.
That sounds like some promising advancements, and obviously a multifaceted problem that you're working across various agencies to address. It's great to know that ARC is really taking this seriously and responding. We're almost at time, and so I wanted to ask you if there's anything else you would like to say to our audience. And again, getting back to that recognition of what ARC is and what it does, what would you like the average American person to know about ARC?
Well, ARC is right now pursuing the agenda that President Biden has put before us, trying to integrate behavioral health into the physical health world so that we can really address the opioid crisis. We're pursuing this patient safety, rebuilding the healthcare system so that the public can continue to trust and have confidence in the care that they receive wherever they receive it. And we're also looking at this issue of long COVID. Many people, particularly in my community, who were essential workers in those early waves were infected and have now starting to show up in clinics around the country seeking care, but quite honestly, our systems aren't yet clear about how we should be dealing with it, what types of approaches are necessary. And so we're working, as I said, we look at both how you manage, how you organize, and how you deliver. And so long COVID poses all of those issues for our healthcare system at the national level, but also more importantly at the local level, where we need to be helping identify ways in which clinicians and health systems can serve their communities.
Fantastic. Well, I really enjoyed this interview, this conversation. We're grateful to have you at the helm, and thanks so much for your time and thoughtful perspectives today.
Well, thank you very much. It was a real pleasure.
It was a pleasure. Over to you, Tim.
I agree. This was great to listen to. So thank you, Dean Perry and Dr. Valdez, both, for an honest conversation about some of the systemic health challenges we're facing, as well as some of the opportunities we have for the future. I really love that long-term challenge you discussed of not just thinking about the next few years, but about those next few centuries. So we are glad to have your advice and your experience to help guide us there.